Today I'm going to go through and show you guys some different techniques to use instrument-assisted soft tissue mobilization to help improve mobility of the shoulder. So first thing you want to do is kind of assess the patient's range of motion. What you're going to have them do is basically kind of like a posterior capsule stretch. You're just going to adduct the arm across the body, and you want to assess them from the front and see how far they can go. So you can see here with Mary, she can't quite go all the way to midline, and then you also want to assess the other side as well. Alright, so see, that's nice and lined up with the middle of her nose there. So what we're going to do is a few different spots on her shoulder. So first spot we're going to do is going to be right here on top of the shoulder by the upper trap. Just put a little bit of the deep prep on there, and then you're just rubbing back and forth here. So you want it to kind of turn red like that. If it's really tight, you can also have them do like a cervical side bend like that to put the upper trap on stretch and do it at the same time, which I'm sure feels really awesome for Mary right now. And you also want to tell them before you start doing this that doing this technique, it is possible that they could have some bruising on the skin because it helps to increase the blood flow and causes like a histamine reaction within the skin. I haven't had anybody that's had the bruising yet, but that's definitely a possibility. So you do that spot for a few minutes. We're not going to do the full time on each spot. Save Mary a little bit here. So after you do the upper trap, the next thing you want to do to kind of help with the mobility of that shoulder is going to be the posterior capsule. So for this part, you're going to do directly over the posterior capsule, but you do want them to kind of do that stretch while you're doing it. So you're going to have them adduct their arm across. This time they can use the other hand to kind of help pull it a little bit. And then you're just going to rub back and forth here. So again, you'll notice after a few sweeps that you start to get that kind of redness of the skin. And they can just kind of go back and forth with their arm while you're doing this. Okay, so that's for the posterior capsule. And then we're going to do one more spot. So last spot is going to be kind of more so on the back, like shoulder blade area, kind of right here where the levator comes down and attaches to the superior angle there of the scapula. So you just want to kind of palpate, find the right spot, and then you want to kind of go right along there. Again, you can have them still do the posterior capsule stretch with this as well. I'm sure it feels really good, right, Mary? Okay. So that's pretty much, those are the three main spots you want to do. You can also follow that up by doing like a subscap release. Have them lay down on the table and release the subscapularis to kind of help with the range of motion. But then after you're done, you also want to go back and reassess the range of motion. So you're having them do that adduction across the chest again. And you can see now Mary's able to get all the way to midline with that arm. Okay, that's it.